Hi, my name is James Sellers, and this is my grand theory PowerPoint on Faye Abdullah's grand theory of 21 questions. Faye Abdullah was a pioneering nurse, theorist, educator, and researcher who made significant contributions to the field of nursing. She was one of the first nurses to shift the focus of nursing from a disease-centered model to a patient-centered approach. Abdullah earned a doctorate in nursing and became the first nurse officer in the U.S. Public Health Service to achieve the rank of Rear Admiral, a historic milestone for nursing leadership. Her career was focused on improving patient care through research, education, and the development of better nursing systems. Abdullah's 21 nursing problems theory was one of the earliest nursing frameworks that emphasized meeting the holistic needs of patients, integrating both physical and psychological aspects of care. Her dedication to advancing nursing education and practice earned her numerous accolades, including recognition as a living legend by the American Academy of Nursing. Abdul Faye's nursing theory is primarily articulated through her 21 nursing questions problems theory, which emphasized a patient-centered approach into nursing care. Abdullah identified 21 specific problems that nurses should address to meet the comprehensive needs of patients. These problems ranged from basic physical needs like comfort and hygiene to more complex emotional and social needs such as anxiety and coping mechanisms. The theory promotes a holistic view of patient care, emphasizing that nursing interventions should consider the physical, emotional, and social aspects of health as it shifts the focus from the disease to the patient, encouraging nurses to engage with patients as individuals with unique needs and experiences. Abdul's theory is rooted in humanistic philosophy, which values each patient's experience and recognizes the importance of nurse-patient relationship, and is grounded in a systematic problem-solving approach where nurses assess, identify, and address patients' needs based on their unique circumstances, as well as emphasizing the importance of patient education and empowerment that ensures that patients understand their care and are involved in the decision-making process. Major assumptions for Abdul's nursing theory is that the primary focus of nursing is the patient, and that the care should be tailored to meet individual needs rather than solely addressing medical diagnoses. With a holistic approach addressing the physical, emotional, and social aspects of a patient's health, recognizing that these dimensions are interconnected, the theory suggests that nursing is both a science requiring knowledge and skills, and an art involving compassion and the ability to connect with patients. Nurses establish a trusting and therapeutic relationship between nurse and patient. It is essential for effective care and positive patient outcomes. Abdul's theory emphasizes that integral role of nurses in providing holistic, individualized care that address the comprehensive needs of patients while fostering empowerment and collaboration with the healthcare team. Faye's 21 nursing problems theory is particularly useful when applied to the no-fly zone initiative during shift change for several reasons. Abdul's theory emphasizes the importance of addressing individual patient needs. The no-fly zone initiative aligns with this by allowing nurses to concentrate fully on handover processes, ensuring that each patient's unique circumstances are discussed and prioritized, ultimately enhancing their care. Effective communication is a cornerstone of Abdul's theory. The no-fly zone creates a structured environment for handovers, reducing the risk of miscommunication, overlooked information during critical transition periods. This structured communication is vital for patient safety. Abdul's theory provides a robust framework for implementing the no-fly zone by promoting patient-centered care, effective communication, and a holistic approach to nursing practice. By applying her principles, the initiative can significantly enhance patient safety, satisfaction, and overall nursing outcomes. Testing the no-fly zone initiative in relation to Abdullah's nursing theory can be approached through the following steps. conduct pre-implementation assessments by identifying specific nursing problems related to the safety and communication during shift changes, as outlined in Abdul's 21 nursing problems. Then gather baseline data by collecting data on communication errors, patient satisfaction scores, and adverse events during shift change before implementing the no-fly zone with surveys and observations. Then establish the no-fly zone, implement the initiative during a defined period, restricting non-essential activities and patient transfers during shift change. Afterwards, you would measure outcomes after implementation, measure the same variables such as communication errors, patient satisfaction, and adverse events, and then determine if there are improvements to collect feedback from nurses and patients. Once you have all your data, you would compare pre and post implementation data to analyze the data and identify if any changes in nursing problems and assess the effectiveness of the no-fly zone. By systematically assessing and comparing data before and after implementing the no-fly zone, we can test effectiveness through the lens of Abdullah's nursing theory, ultimately enhancing patient care and safety. Abdullah's theory is concise and can be easily adapted to fit a variety of nursing contexts, including the focus on shift handovers, but slowing down the transfer of patients by implementing a no-fly zone. Shift changes could have both positive and negative impacts on income, depending on how it's managed and its impact on the hospital's efficiency. Positive impacts on income could be because communication during shift changes can reduce medical errors, which are costly to the healthcare system. And then higher satisfaction scores like HCAHPS are sometimes tied to value-based reimbursement programs. Hospitals with higher satisfaction ratings can sometimes receive incentives. With fewer distractions, nurses also have a higher understanding of patient needs, leading to more efficient care throughout the shift. With better work environments and reduced stress from errors may lead to higher staff retention, lowering costs associated with turnover, training, and burnout. Potential negative impacts on income is that a no-fly zone can restrict patient transfers for up to 30 minutes or longer, which may slow down the overall flow of patients. If the handover period results in fewer admissions or discharges during peak times, it could limit bed availability, affecting the number of patients served and overall revenue. If not well coordinated, a delay in transfers could disrupt the hospital's operational flow. By relieving distractions and minimizing interruptions during shift changes, the initiative can lead to improved communication between nursing staff, resulting in fewer errors and better continuity of care. Patients benefit a more focused and attentive nursing staff during handovers, as nurses can dedicate their time to discussing care plans and addressing patient concerns. Satisfaction scores are likely to rise. The initiative supports nurses by providing them with a structured environment to perform handoffs effectively. This empowerment can enhance job satisfaction and reduce stress, promoting a positive workplace culture. Overall, the No-Fly Zone initiative not only enhances patient care and safety, but also empowers nursing staff and aligns with nursing theories, ultimately contributing to a more effective and responsive healthcare environment.